Good Tuesday evening. We begin tonight like we have so many nights this summer with the air we are all breathing. Today, just one of so many hazy days we've had in the last few weeks. And tonight, the Twin Cities and a lot of Minnesota and Wisconsin are under, again, an air quality alert. These are set to expire Thursday at midnight. But if you're wondering, gee, is this happening more and more this summer? Yes. With raging fires in Canada, those tasked with forecasting exactly when these will hit say no matter how many times it happens, it remains hard to forecast. Case in point this morning, the air we got wasn't predicted.
We expected, and yesterday morning when we had put out our first outlook basically for the day was that it looked like some light smoke was going to drift south across the state and then kind of leave. And then it just kind of kept building and building and it just kind of stalled.
And we were stuck with it. Got worse late morning. As long as this keeps happening so often, you might be asking too, what is this smoke and the bad air doing to you and me and our bodies? Not just young kids, not just older adults or people with health conditions, but all of us. For more, here's Kent.
As the sight and smell of smoke repeats its descent on the Twin Cities, our air quality index is again soaring to unhealthy levels for all. And so is outreach to pulmonology clinics.
Getting a lot more triage calls, a lot more messages to call patients back, because sometimes I get the calls, I'm not able to get the call because I'm already on the phone call with another triage patient.
Hennepin Healthcare RN Eric Lee says patient surveys have shown that those with asthma are struggling now more than ever. But he says his biggest concern is those who don't know why they're struggling.
Have you seen more people that were maybe undiagnosed before this that are now coming forward or calling in?
I suspect we're going to see a lot more of those people. In fact, I've been seeing those in the referrals. They're having fatigue. They can't think straight. They work out for a very, very short time and they can't continue on. They have to rest a lot. They just don't know what's going on.
And his clinic isn't the only one getting referrals.
I have seen a bunch of patients with more respiratory issues this year, especially because of this smoke exposure.
Dr. Pramod Kelkar is an allergist at Allina Health and says even mild allergy sufferers may be experiencing more major symptoms this summer.
What happens in patients with allergies, they already have an inflammatory component to their respiratory tract. And on top of that, if they get exposed to smoke, that's going to trigger some of these respiratory symptoms.
And even if you're an otherwise healthy person, free of chronic conditions and allergies, that wayward wildfire smoke from Canada may be triggering more headaches and nausea.
Sometimes some of those headaches can even progress to migraines. A lot of times you see people with GI symptoms such as nausea. When you inhale a certain amount for an extended period of time, you can have symptoms like that.
Dr. Bamaji Akpa with mHealth Fairview says while simple steps like staying indoors or taking over-the-counter painkillers may help people feel better in the short term, because these wildfires started earlier and are all but certain to last longer than they did even in 2021, wider concerns are growing the longer this smoke lingers.
I can imagine that if we continue to have these fires continue to be a problem on a persistent level, we really have to worry about consequences down the road.
The cumulative exposure over a period of time can be worse than the acute exposure because your symptoms will continue. And at some point, if the smoke exposure is very high level, all of us are going to have some symptoms, especially if you are exercising outdoors.
Yeah, it makes it tough. This morning, you just couldn't escape it. And I was hearing from so many people about that nausea and headaches. So we wanted to get those questions in for you. If you're concerned about how you've been feeling outside in this air over a period of time, all of those professionals said it's a good idea to pay attention to what's happening to your body. We have these alerts for a reason. So you do got to try to stay inside if at all possible. And if you just don't feel well for several days, reach out to your healthcare provider.